Again?
Now we're going to wipe some of the medicines that they use that go back in our work buckets. All the syringes of materials, liquid composite, Theracal, Bond, Etch, these all get wiped. They never go to the sterile room. They get put back into the work bucket. When you're using a composite gun, you're going to wipe, if there's still material left, meaning you can't squeeze the gun all the way down, you got to wipe the tip of the composite compule. Then find a clean section of paper to just dispense a little bit of the material. Find your cap. Try to keep your caps on the counter rather than on your tray. Recap it. There's still enough material in here to do at least 2 more fillings, so we don't throw these away. So after you've wiped the tip, you recap it, then you take it out of the gun. The gun goes to sterile. This gets wiped again. Set it down. All these little bottles and little syringes of material get wiped. The black tips get unscrewed. You're wiping everything here. The doctor's touched it all. You've touched it all. Take off that tip. That goes on the tray. That'll be disposed of in the sterile room. And in the work buckets, off to my side here, is where you're going to find lids for everything. You don't want to go into the bucket with dirty gloves, but you do want to retrieve your caps for all the materials. Sometimes the caps are already on these. You'll just set your caps on the counter. Typically the white etch goes back on the etch, goes back in your bucket. All those are back in there. Couple things left to wipe before we can leave the operatory. Always make sure your wipe canister is closed, otherwise they will dry out. Patient glasses or goggles that they've used get wiped. And set back down. The last thing you're going to wipe, you're going to pick your tray up, you're going to wipe down your counter. You're going to wipe the bird drawer, including the cotton forceps the doctor uses to retrieve the burrs. He's touched them with dirty gloves. They need to get wiped and put right back on top. That's cleaning a dirty op. Light handle, the switch, and then we go to sterile.